Doping in sport should never be used, and that's the reason why it's banned today. The American Medical Society of Sports Medicine defines it as the use of banned substances in competitive sport. Evie Brazier from the Medical News Today Association stated that there are 6 different classes of performance enhancing drugs banned by sports governing bodies. As you can see here, different types of classes are known as stimulants, anabolic steroids, beta 2 agonists, diuretics, narcotics, and peptides and hormones. The United States Anti-Doping Agency defines beta 2 as one of the newest classes of drugs in doping. Defines it as compounds able to treat asthma and respiratory issues. It can increase the amount of oxygen and help the athletes breathe as they go about the competition. However, when you take these, they improve muscle growth, they improve the athlete's endurance, and the athletes can get a lot more energy from taking these substances. On the surface, it seems mighty fine, but the risk of taking performance enhancing drugs is quite a lot. To go over some of them, they raise blood pressure, they can reduce blood circulation, have cardiac and respiratory arrest, kidney disease, decrease good cholesterol, increase the bad cholesterol, liver, kidney, and cardiovascular disease, dehydration, strokes, heart attacks, blood cancer, anemia, and there has been up to 20 or more deaths caused by performance enhancing drugs. Timeline of doping. We'll start with ancient Greece, about the 3rd century BC. If a player, an athlete, was caught doping, athletes would immediately be sold into slavery. Doping had just become invented by then. In the 1930s, it was a common practice, specifically in the Tour de France and other sports. Reardon et al. Wrote that in the 1930s, the rulebook stated clearly that drugs were not among the items with which the athletes were provided. So the different organizations had to provide them for them, or they had to go out and buy their own drugs so they could dope. Now, in the 1980s, the Berlin Wall fell, and it was revealed that the East German athletes were taking testosterone provided by the government. This was East Germany's way of saying that the East German was a dominant individual who could outstand and outlast the Western civilization's athlete or individual. Moving forward, from there on out, the WADA Anti-Doping Agency was formed to try to prevent doping all around. Testing happens on a regular basis now, and if the athlete is caught, they're stripped from all the results, meaning all their medals and every record that they ever did, or every place that they ever did. So, what does this really mean? Robert Veld and friends really state it well. They wrote in their journal article, "The end of doping is most likely an unrealistic term. Due to the human nature into the social and economic implications of professional sport. Now, what they're trying to say here is that so much financially and socially is involved in sport that it'll never be shut down. Since sport will never be shut down, doping will never go away. Doping is an easy and unfair way to improve athletes' performance, which then in turn improve financial obligations of their sponsors, organizations, countries. Doping is cheating, it's unfair, and it should never be allowed in current day sport.